Thank you, Des. Our Acting Permanent Secretary, Ms. Susan Kiran, Assistant Minister for Health and Medical Services, Honorable Alexander, Senior Staff and Management of Ministry of Health and Medical Services, COICA advisors, facility team, representatives from DFAT, Dr. Jenny, Hospital Administrator, is joining us as part of the DFAT team. Media partners, ladies and gentlemen, Nisambula Vinaka, and a very good morning to you all. I thought there was other programs before me, so it just caught me by surprise. And anyways, thank you very much. It's good to see you all, and I'm sure many of you have traveled all the way from other parts of Fiji to be here during the senior management's meeting, the first for this year. So I welcome you all, and we can assure you that the team from Suva will make sure that you are looked after well. So thank you very much. I believe our, what should I say? We were expecting our former permanent secretary to be here this morning. Unfortunately, he's caught up with some family commitments. He sends his apology. In fact, he really would have liked to meet most of you, as you have worked very closely with him during his stay with the ministry. So at this point, ladies and gentlemen, I'd like to put our hands together, all of us, to thank our former permanent secretary for the services he rendered to the ministry in his capacity as the Permanent Secretary of the Ministry of Health and Medical Services. And on the same note, I'd also like to welcome our Acting Permanent Secretary, and I am sure that you will work together with her and give her the same support and cooperation that you rendered to our former Secretary, so that we can take the Ministry of Health and Medical Services to another level. Again, a special welcome to Mr. Shok, who's here with us this morning to support and share his knowledge with us and you during the duration of this meeting. Ladies and gentlemen, I'd also like to take this opportunity to thank you all for the wonderful work that you do in your divisions, in your respective divisions, and on behalf of myself and the Honourable Assistant Minister, I'd like to say a big thank you for the work that you have done so far, and I look forward to the same work continued in this new year. I'm sure you'll agree with me that we have achieved a lot, but we have to go a long way. There's still a long way to go, and thus the rationale behind getting you all together through this interactive session to see how best we can address your challenges, how best we can celebrate the successes that you have so far, and how best we can take the ministry forward in delivering the mandated services to our people wherever they live. Let me begin by saying, ladies and gentlemen, that each one of us have a special role to play in the ministry. Each one of us, whether you're a cleaner, whether you're a gardener, whether you're a nurse, you're a doctor, you're an administrator, whether you're a medical superintendent, wherever you work, in whichever capacity that you work within the ministry, you all have a role, and we respect the role and the responsibility that you have. Because of that, your roles are very important. They assist us in delivering the essential health services for the greater benefit of our Fijian people. And of course, the roles that we are entrusted upon, we need to fulfill that with great diligence, commitment, and dedication. So for those of you who have been doing that, thank you very much once again, and I'm sure as a team we will be able to lift each other's capabilities to the maximum, so that we can perform better with absolute honesty. That's very important, with absolute commitment and with all diligence. Ladies and gentlemen, today's meeting, or the 2 days meeting that we are going to have, is, of course, like I said, is going to reflect on our achievements. It's going to relook at the robust strategies to encounter the challenges, and most importantly, map the way forward to align our plans and strategies and focus on the 5-year and the 20-year National Development Plan. The meeting is designed to be very interactive, to allow you to bring about thorough discussions, and I encourage all of you to maximize this opportunity to identify areas that can be improved and look at new innovative initiatives and plans to enhance the services of our health ministry. As the way forward, ladies and gentlemen, we need you, the senior managers, also to step up in your roles to take the health services to a new level. There's a need for stronger leadership role within the administration of the public health and hospital services in Fiji. I strongly believe you are the very people within the ministry that can help us to make the much needed positive difference. As you are all leaders within your health facilities, you have been trusted to lead. So you need to convey potential enthusiasm and passion for the role of being service-oriented. The Fijian Constitution, ladies and gentlemen, guarantees health care to all Fijian citizens. We, when I say we, you and I both are mandated to be service-oriented by having the heart to serve with compassion and capitalize on opportunities to provide patient-friendly hospital environments and service. As a government, our government family believes that health services should be easily accessible to all Fijians, including those living in rural areas. And as leaders in charge of health facilities, you have a very, very pivotal role to play. So I urge you all to take ownership and pride in your facilities, in your division, in providing the services that we are mandated to deliver with sincerity and diligence. Addressing the challenges within the ministry now and in the future will require us to work as a team and will require us to support each other. And your presence here this morning means just that. And increased networking among different divisions, different units, of course, is the best way to find solutions to pave a positive way forward. Since joining the ministry, the Assistant Minister and myself have been visiting many health facilities around the country, and we see that there is room for improvements in terms of outlook, infrastructure, general services, and of course, customer service and delivery. The rural facilities in particular have been neglected for quite a long time, and we have already started acting on that. However, there's a lot of work to be done. We need to, like I said, we need to take ownership. You need to take ownership of your health facilities and maintain cleanness. Many a times, it's during our visits that we pick on these things and we relay the message and then work is done. However, it shouldn't be there. You are present in your facilities, so it becomes your responsibility to take ownership of that. In terms of, there's a lot of calls for outsourcing services. Okay, we are totally for outsourcing some of the services, and of course there's a need for us to strongly negotiate terms when we do outsourcing contracts, and that's exactly what we're doing, so that service providers who come in through outsourcing actually perform the way we want them to, do what we want them to do. And that sort of had been an issue of the past. So we are trying to now seriously negotiate contracts when we outsource services. And of course, the agreement that comes with outsourcing is to ensure that the service provided, like I said, is aligned with the core values and principles of customer care and excellence in service delivery. Moving on, I'd also like to reiterate on the need for us to cultivate friendly, professional attitudes amongst all our healthcare providers, and we need to instill a sense of compassion and empathy for those in our society who suffer from the effects of ill health. That's the very reason they come and visit our health facilities. And the attitudes of our of our healthcare providers is very important, so that the experiences that our people have when they come to our health facilities is long-lasting. You're aware that we have set up a line, a contact line, a healthcare line where people put in their concerns and grievances, and of course that is addressed. That also allows us to see how best we can address those challenges and make the experiences within our health facilities for our people much acceptable. So, ladies and gentlemen, and we can, I'm sure we can make an impact on those we serve if we set our mind to it. That's very important. Each one of you here today, or each one of you present here today, are supervisors or heads of divisions and have employees that work under you, under your care, under your supervision. Therein, you are at a decision-making level. And the decisions you make as leaders will have a profound impact on the health ministry. It will have a profound impact on the lives of our Fijian families. And of course, it's going to have a profound impact on the future of our people in this country. So let us begin with our departments, our divisions. Let's inculcate those core values of respect and unity. You need to work as a team. Many a times we come across divisions and heads who are very territorial. They don't want to share resources. They don't want to share practices. They hold back. Now, that's not teamwork. Your presence here today, like I said, is to network, build that team, because we all work for the same vision. Our vision should be the same. So if you are territorial, please, I don't think so. We need that practice within the ministry if we are to move forward. So when you are at a decision-making level, the decisions, like I said, that you make must be in line with the government policies. I'll give you an example. Recently we received some concerns from some government wage earners who were not paid for their overtime. Now, the government policy is every civil servant must be paid overtime. However, we had some senior managers who decided to do things on their own. Now, through this forum, please let me allow you. We all need to be on the same page. We all need to be on the same platform. We all need to follow the same policies. We cannot deviate and make our own policies. That creates a lot of problems for us at headquarters. So while you are here, you have issues with that, please discuss with yourself. Many a times people are told, oh, we don't have the funds to pay you. You have the direct finance here. Okay, and when I call him and I ask him, do we have the money? He says yes. The requests don't come in. So please use this forum to thresh out those issues. Through your networks, please see what others are doing, especially the MSs of the 3 main divisional hospitals, the SDMOs, the DMOs. You have a very, very important role to play, and we want every staff within the ministry treated in a similar manner. I can't have staff calling me and saying, I haven't been paid my maritime allowance, I haven't paid my overtime allowance, and all those allowances that they rightfully deserve to be paid. So cost center managers, please ensure that these things are they don't become a common issue for us, and all our staff are treated well and fairly when it comes to paying them for the services that are rendering, our drivers, our cleaners, the various level, the cadre of people that work for us, and everybody needs to be treated fairly. If they work, they expect to be paid. And if we have made provisions as a government in the budget to have them paid, please ensure that they are paid in a timely manner, all staff. So we do not have issues arising that our staff are not paid. So, like I said, please begin with the divisions, begin with the departments, and I'm sure that we will see positive changes happening with a positive mindset and a positive attitude from all of us. And I also understand that you have many challenges in terms of resources, transportation, the geographical locations that you look at, and they restrict you from performing the best of your abilities. So use this forum, talk about it, and come up with solutions that will best give you answers to the problems that you have. And again, through the meeting, we intend to look at streamlining the plans and strategies to enhance service delivery, and also put in place systems and probably new systems in place. We have a new acting permanent secretary. I'm sure she comes up with her own expectations and the way how she wants to run the ministry. And like I said, I urge you all to cooperate with her. And the public sector, ladies and gentlemen, you are all aware, is under scrutiny now more than ever. And our health ministry is part of that. And we are required to respond to the increasingly complex demands from citizens to the significant changes in our global environment. In attempting to grapple with our own social and economic issues, we undertake reform programs to readjust and realign our policies and skills to be able to integrate and align ourselves effectively. I'm pleased to note that there has been some significant developments within our health service, and there are proposed plans for further enhancement. The recent one being the establishment of Valelevu Health Center. We opened it a couple of weeks ago, and indeed we have received positive feedbacks from the public in the Sinu area, and they welcome this initiative by the ministry. And we are told that the Valelevu Health Center now is able to handle close to 500 to 600 people within the 24-hour span. Of course, there are plans to have a new ED, which will have a resuscitation room and 4 holding observation beds, doctor's consultation rooms, scan room, ambulance bed. Of course, all that is part of the coming plans for Valelevu Health Center. They said that the current emergency room will be refurbished to cater for IMCA clinic, and of course the staff will be given a restroom and a dining room. This will of course take time, and as soon as the tender process is finalized, work will commence as soon as possible in that. In the Suvarnasori corridor, ladies and gentlemen, there are new health facilities that will open, and of course will uplift the health services and improve accessibility. We are looking at the new Makoi maternity unit, and I think a date has been finalized later this month, where we will see the opening of this maternity facility. Then we have the Naulu Nakasi Health Center, and of course we are also looking at opening the Waimaro Health Facility in Ra, and the start of the Kayasi Health Center in Singatoka, Kayasi Subdivisional Hospital in Singatoka very, very shortly. Having said that, I believe that while we can keep on building infrastructures, right, it's the people who work within the facility make a difference. So, like I said, because you are the heads, it is in your hands how you guide your team to provide the service delivery we are talking about. Good news for us, we have received 30 new ambulances from the People's Republic of China, and not 200 has been circulated around. So it's 30 ambulances for the Ministry of Health, and it is a donation, and I'm sure it will bring about much relief to those senior managers who are asking for ambulances. So I'd like to thank the People's Republic of China for this much awaited donation for us. Ladies and gentlemen, as far as the development sector is concerned, Fiji is broadcasting its partnership with both international and local partners to strengthen our multi-sectorial approach. I'm pleased to say that we continue to receive a very strong and positive support from all our stakeholders, mostly UNICEF, DFET, WHO, UNFPA and SPC, just to name a few. And this year we will continue to expand our horizons for increased partnership to develop our health services. Again, thank you to all our partners for their support. So ladies and gentlemen, it is only in forums such as this that we can recognize your successes. Like I said, we recognize the services that you provide to your divisions and to our people, and the fact that we need to move together as a team in a capable and encouraging manner. It will not be easy, but I have faith in the work that you do. I have faith in the senior managers that we have within the system, that together we'll be able to pave a new dimension to the health service delivery. So finally, ladies and gentlemen, I know you're all eager to get on with your business for the day. I look forward to learning about the outcomes of your two-day deliberation, and I can assure you that you have full support of me and the executive team at the headquarters in getting geared up for new challenges and expectations that lie ahead of us. And truly use this opportunity as a platform to broaden your knowledge, network, share experiences, and build the teamwork that is needed to achieve what is best for the ministry and what is best for the people of the nation. With these few words, ladies and gentlemen, I hope it's not too late for me to wish you a very, very, into February now. The year has just started. Please allow me to wish you and your family the very best of 2018. And may we work as a team for the betterment of the services that we are mandated to deliver to our beloved nation. So thank you very much, and God bless.